Hello guys, welcome back to the Cybin Molby show from me to we. When I had done my last video, I had a few comments. How do you go about with the adaptation program? So the main reason for me doing this video is just this information for all those people who had asked me about this information, and I'm really happy to share it with you. But to let you know, I had not done an adaptation program. Basically, I had done an aptitude program, but I'm going to explain both in detail, like what is the basic difference between an aptitude test and an adaptation program. Hope this video is going to be helpful to you all. And one more thing which I want to tell you guys is that in case if you're interested in more of the roasting kind of videos, please do go ahead and check the videos on this website, which I'm going to put it down. That's RR Jokes. So that's another YouTube channel, and he does a lot of roasting videos. So if you're interested in all these roasting videos, please don't forget to go and hit a bell icon and subscribe his YouTube channel. That's RR Jokes. So let's go on to the video now. So let's begin with the aptitude test. Now for aptitude test, basically like if you're applying it from home, it's usually the agency does everything for you because you come here through the agency. So basically it's your employer. So they book an aptitude for you. Now let me let you all know that you all cannot make a decision of whether you want to give an aptitude or an adaptation program. It's basically, you know, whatever agencies you're applying through and whichever hospitals you're applying through, and whatever is available in that particular hospital, that will what will be notified to you. So it could be either aptitude or either adaptation. Now let's move on to the aptitude test. For the aptitude test, what you have to do is usually when you reach Dublin, this program is usually done in the RCSI that's situated in Dublin, but before we start with the program, actually that's the aptitude test, you have a week for the preparation time for the aptitude test. Now in the aptitude test, it consists of two categories, that is the theory program, that's a theory test, and secondly it's the practicals. In the theory test, there's around 150 questions and you have to clear about 50%. Usually in the theory test, everyone is able to clear. There's no failures usually in the theory test because it's all your basic questions, whatever you have done in your basic nursing program and the nursing education, whatever you have taken. And after you clear the theory exam, you will be notified through an email saying that you can now book for your practical examination, which is done by your employer itself. So you'll go for the aptitude practicals. Now in the aptitude practicals, there is usually around 14 stations. It usually used to be around 20 stations, but lastly when I had given it like a year ago, we had 14 stations, but I'm extremely sorry, like I won't be able to tell you what exactly is going to be there in those 14 stations, but let me let you all know, like there's nothing to be scared about, because you know the 1 week which you'll actually get to prepare, and even when your employer has already booked you for the aptitude test, they will send you a lot of curriculum which you'll have to study and you'll have to prepare before actually going for the aptitude test. And now I will be sharing a link below my YouTube channel, so you can click on the link and you'll come to know about the various topics which is there. There's loads of topics, like it's a vast range, so I cannot tell you particularly which station would be what, like it could be anything in those 14 stations. And but to let you know, there's no need to get afraid, because if you prepare well and if you are really well with your bedside nursing, hopefully you should not have any problem with it. And secondly, there's nothing to get so nervous about it, because usually the main difference between aptitude and adaptation is usually a 6 to 8 weeks program, whereas an aptitude test, it's like when you come to Dublin, you get a week's time to prepare, and you'll be notified about your result and you will immediately get your PIN and immediately can start working. Whereas for adaptation program, you have to wait for 6 to 8 weeks. Once all your skills and everything has been assessed, is only then you get your PIN. So that's the main difference. That's only the time frame. For the adaptation, it's usually 6 to 8 weeks, and whereas for the aptitude, it's just a week and you give your practical exams, and then immediately you apply for your PIN. So you can start working quickly compared to adaptation in your aptitude. But aptitude is a bit more difficult than adaptation program, because in adaptation program you don't have like a practical one-on-one stations, because you usually have a preceptor who will be guiding you throughout everything. But that I'm going to explain to you in the later half. In the aptitude test, the 1 week which you usually get, the RCSI will mail you all the details about what you can study and what all things it's necessary, cover all the topics. So basically just cover all your topics, like what would you do in a patient with epilepsy, what will you do in a case of a patient if he's got hypoglycemic, what will you do in case if a patient has got some infection, etc, etc. So it's basically your basic nursing care. Whatever is the topics they have given you, try to complete most of the topics when you're going for your aptitude exam, because there could be drug calculations and n number of different things. But like I cannot exactly tell you like what exactly will be coming in the practical stations, because it's different every year, so I won't be able to tell you, and it's all these things are actually kept very confidential, so we cannot exactly let you know like what exact stations were there for me. But it's always good to do completely whatever you have studied. I would just like to tell you, like, whatever you have studied in your nursing, just give it a brush up and they will send you a few details again on your mail. Just try to cover up most of the topics whatever they have given you. So once you clear your aptitude test, you get your reference. Now your reference is actually your PIN number. Whatever reference number you get is later on what is the PIN you get. So usually once you clear your aptitude test, you'll be notified through a mail saying that you've cleared it. So there are 2 attempts, and these are the only 2 attempts which you get. So if you're not able to clear it even in the second attempt, there's no chance, there's no hope, you have to come back. You have to go back home. So it's that simple. So definitely when it comes to aptitude or adaptation, aptitude is more challenging compared to adaptation program. But otherwise, I would like to say one more thing. But like if you can prepare it very well, and if you're confident, and whatever you'll have done, like whatever nursing, whatever you'll have done, your basic nursing course, whatever you'll have done at the bedside, guys, if you're confident about it, say for example, just always keep one thing in your mind. If you have anyone, forget about a patient, like if you're anywhere, like say if you're in a park, just to go very precise and with a small example, if you're going in a park and if you see someone just lying down on the floor, what will you do? What will be the immediate management and for them? Like say if he's getting a seizure in front of you, so what will you do? Just always think and assume stuffs, like say if something had to happen to someone like that, and if you get a patient, if you come across someone who's got a seizure, what you'll do, what will be your nursing care for them. So it's something like that. So it's just all your basics, whatever you'll have studied. So if you all can really brush it up well, and if you're confident, and if you can speak, and just in that confidence, whatever you'll speak will be the best. So that's only what I want to say about the aptitude. Be confident in whatever you tell the examiner. That's it. So that's about the aptitude. Now let's move on to the adaptation program. Now the adaptation program is basically a 6 to 8 weeks program, and in this 6 to 8 weeks programs, you will have a preceptor and you will be the preceptee. So basically you'll have a preceptor as well as a clinical facilitator, or you can say it as a nurse educator. So basically they'll be the people who will be guiding you throughout this 6 to 8 weeks program. Now the preceptor, what is your role towards your preceptor? Now your preceptor for everything, like whatever, now as I said, it's a 6 to 8 weeks program. So every week you have been analyzed. Every week you have been analyzed, and there are different stages of this assessment. There's an initial stage, there's an intermediate stage, and there's a final stage. So basically, you have a preceptor. Now your preceptor will be guiding you. She'll be teaching you, or she or he, whoever it is, will be teaching you, will be guiding you throughout all the procedures, because you're going to get a book from the NMBI with various checklists. Now it depends whichever ward you are going to. Now if you're going into the medical ward, you will have all the medical procedures, whereas if you're going to a surgical ward, you'll be getting all the surgical procedures. So basically it just depends on whichever ward you are allocated. You'll be getting a checklist according to that particular ward. That's the medical or surgical or an ICU or whatever it is, wherever location you're working in the hospital. Now what they usually do is your preceptor is the one who's supposed to teach you how to go about with things. In the adaptation program, that's from 6 to 8 weeks, always remember one thing: you cannot do anything by yourself. Whatever you have to do should be under the guidance of a preceptor. So you are always supposed to be supervised by someone. So you cannot do as simple procedure as checking a blood sugar. That's the most simple procedure, but you cannot even do that without a proper supervision. As simple as that. So now your preceptor will be teaching you a lot of stuff during the 6 to 8 weeks program, and they'll be analyzing you and they'll be assessing you according to it. So one thing which I would like to say is, because I haven't done my adaptation program, but my friends who have done, through whom I've got that, I've collected this information in order to help to get this information to you, your people who are actually watching me, is just that. Always remember a few things. First, have good communication skills. Secondly, try to learn and grasp as much as things you can, and try to be very quick and fast and vigilant in your job, whatever you're doing. So these all things could actually impress your preceptor. And these things, and it's all these things are going to be taught to you gradually in your every week's program. So after every week, basically your preceptor will be telling you like where your flaws were, where you were lacking, where was your skill not that efficient. So she'll give you an update about it, like a brush up every week. So that's something very good. And the best part about adaptation as compared to aptitude is like actually you can go to the bedside of the patient and you're getting to do things like you're trying to get more of hands-on with the patients as compared to the aptitude. You're not getting a proper patient, like a proper real patient in adaptation program, whereas you get to know patients one-on-one, and you get to do a lot of things with the help of your preceptor. So that's a very good advantage. Secondly, now when it comes to assessment, like they'll usually, when the program starts to the end of the program, the whole program is about your assessment, how you're going about with it. So like I said, there are 3 stages. First is the initial stage, wherein they'll see how you are about and where you're lacking and where your skills are and what your potentials are, etc. That's your initial stage, initial meeting, which is done. Secondly is your intermediate meeting. In the intermediate meeting, now once you have almost finished like around 4 weeks or 5 weeks, they'll get a rough idea about it. So usually it's in the intermediate meeting. They tell you whether you have cleared your ROSCE, that's your adaptation program, and whether it will be extended. So like I said, it's usually a 6 to 8 weeks program, but it could go even up to 12 weeks. So that will depend on your extension. Now in the adaptation program, usually it's very rare that not most of the people usually get extensions, because like we are all very good, like being nurses, we are already treated patients, we have been with patients, so we are very good in our skills. And I believe that we all have that confidence. It's only that confidence which you need to go when you are going for this adaptation program. If you're confident about yourself, nothing is going to keep you back. Trust me for that, guys. So in the intermediate meeting, they usually tell you whether you are going to get an extension or are you confirmed. So in the intermediate meeting, when it's done, they usually ask you to sign a few papers. If it's an extension, they ask you to sign a few papers, and then they forward it to the NMBI. Secondly, if it is not an extension and if it's confirmed, like you are going to clear it, you have already cleared it, you'll come to know by the intermediate meeting, and they'll send you a few forms. So in that forms, what you have to do is usually you put in all your details, you put in all your bank details, and there is an amount of fees which you pay. But I'm not going to mention about the fees because I'm not sure if it has been changed from last year. So you could just go onto the website like I told you all and check about what the fees is exactly if you are coming through the employer, like through an agency. So basically, once all this thing is done, you get your, your reference, that's your registration number, your full registration number within a week or 2 at the max. Within 1 to 2 weeks, you'll get your registration by post. Now remember guys, in the NMBI website, we all have our own account, that's my account. Now suppose if from whichever place at the beginning when you all came to Dublin, you all might be staying in one place, but maybe in a few months, you all might move. It's not just Dublin, like wherever you all are staying, whichever location, always remember to change your address to whatever possible place you all are at current living, because usually the NMBI send up a lot of newsletters, updations and stuffs. So it's always necessary you go into your My account and keep your address updated so that you can have a good contact with them, and so that NMBI can also be in contact with you and you are also updated with all the latest informations. And I hope this video is helpful to you all, and I know that people who are going, and especially all the best to all the people who are going to apply for the aptitude or for the adaptation. Guys, give it your best and you're going to rock, and welcome to the new family of nurses in Ireland, and we are more than happy to help you if you all have any doubts or anything. Just feel free to just comment below in our YouTube channel. So guys, don't forget to hit the bell icon, subscribe our YouTube channel. That's from me to we. So until the next video, it's good night, bye bye, take care, stay blessed.